Hi, I am Dr. Guruprasad Hosurkar, consultant neurologist at Columbia Referral Hospital, Yeshwanthpur. My special interest is Parkinson disease and movement disorders. Parkinson disease is a progressive neurodegenerative disorder. So what happens in Parkinson's disease is that there is progressive degeneration of niagral neurons, which is situated in the motor circuit area, basal ganglia, brain, upper brainstem, midbrain, and there is a progressive loss of these neurons, and the dopamine is a neurotransmitter which is very essential for our motor movements. So there is a type of dopamine deficiency in Parkinson disease brains. So there are different types of Parkinson disease. The common type of Parkinson is what we call idiopathic. Idiopathic means that there is no specific reason. We know for sure that there is a genetic predisposition in these patients and there's some environmental influence, and then a person develops Parkinson's disease. There is some amount of clustering in the families, but these are not familial cases. Whereas if you take a type of Parkinson's disease which the onset is below the age of 20 years, there is a clear-cut genetic predisposition, and we know some of the genetic mutations can cause Parkinson's disease. So the common type of Parkinson's disease, we still don't know the reason. Whereas there is something called mutation Parkinson disease, which can start at a younger age, and there are definite identifiable genetic mutations which can explain the reason for Parkinson's disease. But there's also something called secondary Parkinsonism or Parkinson plus syndromes. In secondary Parkinsonism, the features of Parkinson disease may be a little bit subtly different, but there is a definite etiology. You can have drug-induced Parkinsonism, you can have metabolic reasons like hyponatremia causing Parkinsonism like features, or there are other progressive degenerative conditions like MSA, progressive supranuclear palsy, where the degeneration is more widespread. It is not only the dopaminergic neurons which are degenerated, there are other cholinergic neurons or cholinergic neurons which are degenerated, and there the non-motor symptoms are also very high, the progression is more faster, the prognosis is more severe in terms of the recovery from the response to medications. And so how do these patients cope up with in patients with Parkinson's disease? Idiopathic Parkinson's disease, which is a common type of Parkinson's disease, usually is amenable to medical treatment. Initially we start with Dopa agonist or Anticholinergic medications, especially if there is a tremor predominant Parkinson's disease. They respond really well. But as the disease progresses, you require levodopa, which is a gold standard for patients with Parkinson's disease. They respond really well. The tremors, the slowness, the stiffness, all the features of Parkinson's disease respond to these medications. But 90% of the patients do progress over the time. After 5 years, 6 years, the disease becomes bilateral, they develop axial symptoms, they can have recurrent falls, they can be freezing, they can be what is called motor fluctuations, they can be wearing off effect of medications. The effect of the medicine may not last longer, they require frequent doses, they require optimization of medications more frequently. That is a time when we look at alternative treatment. So the good thing is that a lot of research has gone in, and last 20-30 years we have alternative treatment like surgical treatment or different route of administration of medications, so to bypass the gut and have effective control of Parkinson's symptoms.